So imagine this. You go into the ER because you're sick, or you're giving birth, or you're having a heart attack or chest pain of some sort. The first thing they do is get you into a room, and then they stick a needle in your arm. They don't explain the procedure. They don't explain who they are, what their certification level is. They don't tell you what's going to happen other than, I'm going to do an IV on you. It can be pretty scary. During the speech, I'm going to explain to you how this process goes. I'm going to show you how it happens, and then I'm also going to tell you what could possibly go wrong. At some point during your life, you're going to have an IV. It's bound to happen. Whether it's some of the situations that I just described, or if you're just having to give blood for your doctor for a physical. So for me, I'm an EMT. I'm certified to do IVs. I do them all the time in the ER. I also do them on an ambulance while we are moving in the ambulance, which is hard because it's bouncy back there. So like I said, at some point in your life, you're going to have an IV. If you haven't had one yet, it can be pretty scary. The healthcare professional is just going to stick a needle in your arm and gain access to your vein. So how do they do it? What should you expect? During the speech, I'm going to explain the process, show you how it's done. I will also explain what will happen if they miss the vein and what can go wrong during giving the IV. So the first thing that you're going to want to do, you're going to want to wear gloves. So you put your gloves on. The reason you're going to wear gloves is to protect yourself from your patient's blood and to also protect your patient from whatever's on your hand, since you're going to be causing an open wound. The next thing that you're going to do is put a tourniquet on their arm. I'm going to be sticking him down here, so I don't need it to be all the way up here, but I'm going to put it up here because I already messed up on my last speech, so I have to start over. So I'm going to pull up his arm, or his sleeve, not his arm. I'm going to put the tourniquet on. You want it to be pretty tight, so I usually go all the way out. You have to be careful though, because sometimes it can pinch. If it does pinch, just apologize. It's something that can happen. So for him, he has really good veins, as you can see. There's a lot of them all over. But next thing that you're going to do, or that they are going to do if they're doing it on you, they're going to palpate to try and feel for a vein. Palpate just means feel, and it's just a quick little motion like this. And I'm going to do this one right here. Decided. Or that one. Is it okay if I do this one? Are you okay with that?
Whatever you want to do, Chica.
Okay. The tourniquet, the purpose of the tourniquet is to help you gain access to the veins. As you can see, all of his veins started to bulge out and get bigger with the tourniquet on. So one thing you want to make sure that the person does when they're doing an IV, that you want to make sure that they hold it for a second to make sure it's not an artery. If it starts to pulse, you'll be able to tell if it's an artery or not, just like that. So next, you're going to clean their skin with a solution. I'm just going to use alcohol swabs. That's what we use on the ambulance. And I just go do circles and I go out like that. And then I use one more and I just go straight down to make sure it's extra clean. You want to wait for it to dry for a minute. You don't want it to get still be wet when you do the vein, do the IV. You don't want to blow on it. It's going to cause whatever is in the air to go straight onto it. So I have my what I'm going to use for the actual IV. It's called a catheter. There's a piece right here, a little bevel. That's going to be what I advance. So when I advance, there's just going to be a little straw in there. And then there's my needle. You'll see how this works in just a second. So when you go to do an IV, you want to adjust their arm as you need. You don't want to do it super high like this, because it's going to go right through. You don't want to do it super low, like straight even with their skin. It's just going to go right over it. I usually do about 30 to 45 degrees, just about that. So you're going to pull traction. Since I'm doing it right here, I'm going to hold it like that. Pull my traction, big poke. So as you can see right here, can you get that real quick? There's blood filling up in this chamber. It's called a chamber. That means I'm in the vein. So I'm going to go in a little bit more. I use 2 hands for this just because I think it's a lot easier and more comfortable for the patient. And you're just going to advance your catheter in. Same time, you're going to be pulling that needle out. And as you see, there's blood right here. That means I'm perfectly inside that vein. That click means that there's no vein, there's no needle inside his vein at this time. Next, you're just going to disconnect this part, which is the hardest part for me, I think, because you're wanting to hold, this is not a bloodless. So I'm going to hold a lot of pressure right here to stop him from bleeding. So the ones I thought we had here were all bloodless. This one is not. That's why there is a little bit of blood. So I'm holding a lot of pressure to stop that from bleeding. I'm going to put my extension on it. Once that extension goes in, there's not going to be any more blood coming out. So real quick before I move on, I'm going to clean him up, just because I think it's kind of rude to let him sit with a bunch of blood on his arm. Well, I'm very, very, very well inside that vein. I have a little saline flush here. And really quick, I want to explain something. This kind of an IV that we use, it completely locks it out. There is no needle that is showing in any part. So there's no risk of being stuck by a needle that's already been used. So I have my flush here. I'm going to attach it to my extension and it just twists on. And I want to be very careful because once I start that, I'm going to have blood coming. And you also want to be careful because you just don't want to pull that out because it's going to be painful. So I'm just going to flush it. Were you blowing on it? No? I'm going to take that tourniquet off because I think it's hurting his arm. He just asked me to take it off. Does that feel better?
Yes.
Okay. If I pull back, I'm going to get blood return. Sorry, I'm blocking the camera. I didn't even realize that. I'm going to get blood return. The more I pull back, I'm going to push forward and get some of that blood out just to be nice. All right. So I'm going to take this out of his arm. I'm going to push down. I'm just going to pull. And you want to be careful you don't fling the blood everywhere. So some of the things, can you show me real quick? Some of the things that can go wrong during an IV. If I had missed and gone right next to that vein, I could have done what's called fishing. What fishing is you actually have the IV in and you're just twisting it around and you're feeling for the vein and then you push it in more. It's very uncomfortable. It's very painful. I don't like doing it unless I absolutely need that IV. That's the only access point I have. A lot of people really like to do it and think it's really good. I personally think it's very painful. I've had it done to me. It's very just uncomfortable and I feel like really mean when I do it. Another thing that can go wrong is if someone doesn't feel for a minute. If you feel the vein, like I said, you'll know it's not an artery. If you don't, when you hit that artery, you will have caused an arterial wound, which is going to cause you to have to pull that IV out and hold direct pressure until that clots off. When you receive an IV, you put complete trust into a stranger that you've never met. You have no idea who they are. And it's really scary. So if something goes wrong, you don't know if you can trust them or not. The hardest thing with getting an IV is staying calm. I've explained what I was going to do to him before I started just to kind of save some time. It helps a lot knowing what's going to happen, knowing how it's going to feel. It helps a lot knowing that the person that's going to do it to you is experienced enough that they can explain all of it to you perfectly fine and perfectly clear. So when you get an IV, the best thing that you can do for yourself and for the provider is just to stay calm. If you tense up, you're going to clench those veins off and you're going to have to get stuck again and again and again until you can just stay calm. So through this speech, you now understand how an IV works, what happens, you understand what can go wrong, which is going to help when you do have to get an IV. Like I said, the biggest thing to do is just stay calm. So thank you for watching.